We are back on Taking Care of Business on Koerner Radio, News Talk 1180, 1230 KGEO, and 1410 KERI. Our guest by phone, Rodger Bayne, Vice President of Group Benefit Services, talking about Clay's favorite subject, Obamacare.
Hey, Rodger, are we headed for a single-payer system under these programs?
Well, I think it's clear that this was a willful attempt by many members of Congress to move us in that direction. There are many components of PPACA that, in fact, do start to take greater and greater levels of control of the healthcare system. And, in fact, even in the District of Columbia, they are contemplating today that the health benefit exchange, which will be available to employers up to 100 employees in Washington, D.C., will be a single entity, the only place. It will eliminate the private sector delivery of healthcare systems and will be the only purchasing vehicle for groups between 0 and 1 and 100 employees in the District of Columbia. So there is a very solid, last I've heard, is a 50-50 chance that could pass, eliminating sales of benefits outside of the benefit exchange in Washington, D.C.
And who's going to explain these benefits through the benefit exchange to the general public and the employers?
Well, PPACA has a pretty extensive, or at least a pretty wide-open provision about establishing a navigator program. The navigator is a bipartisan individual that would function under the auspices of a health benefit exchange, paid by the exchange or exchange grants, depending on how the exchange decides to establish that navigator program. And states, and each state exchange will have a lot of latitude in how they build their navigator program, but technically a navigator is that which should be explaining those benefits of the exchange and how these tax credits and subsidies may be of value to them, whether they are eligible for Medicaid instead, or whether they're required to stay on their employer's plan in the event their employer is providing affordable care already.
So rather than having a professional insurance agent who has to be licensed and trained and have continuing education, we're going to go to a post office type employee as a navigator that's going to explain and enroll people into a health care plan. And in California, as an example, in California under the Healthy Families Program, and any individual can enroll someone into the health care program, but they can't recommend or explain the plan. That's what we're looking forward to, aren't we?
Well, every state is going to be different in that regard, but yes, I suspect we're going to run varying degrees of that. In some states, it could be even worse than that. I've heard things as loose as establishing local community groups and church groups where they can sit on a Sunday afternoon at church and explain health benefits to people that come. In this case, if that were the extreme case where the person does not need to be licensed, certified, or registered to be a navigator, we're looking at a great miscarriage of justice potential to many of those consumers, because the option of which benefits and how to purchase benefits is far more complex than I think most people give it credit.
Yeah. Do you think we're heading to that, though, where it'll be as simple as going to a church group maybe at a Bible study and have them talking about healthcare and signing you up?
I think that's far on the extreme side. I think in reality what we're going to end up with is some varying levels of certification or licensing in order to be a navigator. And unfortunately, it may not be as extensive as it is to be an insurance producer. I have been an advocate that an insurance producer should be a prerequisite to being a navigator, because you first have to know what the insurance producer knows before you can navigate the options between commercial insurance, the exchange, and then public sector programs that will be offered through the exchange as well. I think it's actually a navigator in an ideal world would be a level of certification above that of a typical insurance producer. I do not, however, see that coming. I see the states taking a much easier route of looking to hire entry-level employees, train them to help people navigate through the software and the system, and that would be the initial core-level threshold of being sure they can be a navigator, is helping someone navigate the website.
We're having a conversation for the hour with Rodger Bayne, Vice President of Group Benefit Services, talking about Obamacare.
You know, Rodger, this is Clay, and as an insurance producer with numerous thousands of employees that we service, we spend the majority of our days servicing the accounts, not selling new products. How's a navigator going to do that?
Well, a navigator really won't do that. I don't anticipate, and I don't know that any state exchange anticipates a navigator having to service clients. The exchange, on the other hand, will be charged with selecting which health plans will be qualified to offer coverage in the exchange. And the customer service level offered by that health plan directly would be one of those benchmarks on whether or not they're eligible to offer in the exchange. So they should be providing their own customer service. In a real world, I think you and I know that just doesn't happen that way.
As an aside, though, isn't it true that the carriers will also be able to offer plans outside of the exchange that will be done through insurance agents?
If the state exchange or the state legislatures each deem that, again, the District of Columbia is suggesting otherwise at the moment. It's not in stone yet, and it's not been passed, but that's a big contemplation. In Maryland and in many states, there will likely be coverages offered inside the exchange and outside the exchange. And the state's posture, or the health benefit exchange in each state, will have a certain posture in determining where those lines can and cannot cross.
Let's talk for a minute a little bit about some of the benefits that are either being added to the medical insurance programs or taken away. Can you address any of those?
Well, I don't want to get into specific benefits, but what I can tell you is that essential health benefits have been determined to add 10 major categories, and the bulk of those categories are very obvious and historically in health plans today: hospital coverage, major medical prescription drug coverage, and things of that nature. There are a couple of additional benefits, such as rehabilitative services and also certain services for children in the area of optical and audio coverage for children that are not typically offered in health benefit plans that need to be added in order for a plan to provide in the small group market what we would call essential health benefits. Those essential health benefits also have added the preventive care, which is already in place, which most of us have heard about. It happened 6 months after the enactment of the law. We had to begin adding free preventive care with no co-pays, deductibles, or cost sharing. So these benefits will, in fact, increase the price of that root care. But the biggest problem with essential health benefits is that PPACA passed this power to the Department of Health and Human Services to decide finally, once and for all, what the essential health benefits should be for American citizens. And after great debate and expensive study, the Department of HHS passed on that decision, handed it back to the states at least until 2016. Now, what that means to me is we had the opportunity to establish a standard and yield great efficiencies from administrative costs in the health insurance business. And instead, we bailed out on that opportunity, handed it back to the states where they have a complicated method of determining what their essential health benefits should be, and then we, in essence, could have 51 different sets of what we would call standard essential health benefits in America, and a health insurance carrier that works in multiple jurisdictions and conceivably a national carrier that works in all 51 will have 51 different sets of required benefits instead of one. Now, if you can think about trying to administer those policies and pay claims on 50 different sets of covered benefits, you can imagine how much more expensive that would be than having a compliance department that manages one standard set of benefits.
Yeah, Roger, that's insane. I have a question for both you and Clay. So in California, they tend to be very aggressive, and I feel in the wrong direction. Can you guys touch that? I mean, where's California at? We're kind of in the lead in this, right?
Well, I can touch on that a bit. California was the first to establish an exchange, and the person running the exchange has already, and I hate to say this, operated 2 failed programs. So I'm not sure that our exchange is going to be any more successful. Also, California just taking the lead.
Mm-hmm. So that's not necessarily a good thing from our perspective because, we're probably going to be the model for a lot of the other states.
Well, one of the things California had said was if the Patient Protection and Affordable Care Act had not passed, that they would pursue a single-payer system.
Regardless. So depending upon what happens, in November, we may be faced with California having a separate suit assuming Romney wins and something happens with, the Affordable Care Act.
Actually, January if Romney wins,
right,
correct.
Right.
But I don't know how Romney's going to get rid of this bill anyway. Do you have any ideas on how Romney would get rid of this bill, Roger?
Well, that's an interesting challenge. I mean, there's been a lot of discussion about how to get rid of this bill, and an outright repeal will be very, very challenging. You would have to have not only the presidency, but the majority in the Congress and in the Senate. So that's going to be a major task to repeal it outright. There's been other discussions about the latitude given in the regulation, where as he appoints new parties in these regulatory bodies, there's a very good chance that many of these regulations could be normalized back to some of the stated intent, or at least more rational attempts at regulating the market within the legislation. And then ultimately there's the discussion of not funding it, and just the ability of our government and our society to continue to support the cost of this law as being the major thing that could break its back.
Yeah, definitely. When we come back from the break, Roger, I've got a question for both you and Clay on the fiscal end of this.
Okay.
We'll be back in a moment on Taking Care of Business on Koerner Radio, News Talk 1180.